Hi, everyone, and welcome back to the Hair Loss Show. In today's episode, we're going to talk about the different types of techniques with FUE surgery. So stick around. So one of the common questions that we get asked in clinic a lot is, and if someone is planning to have a hair transplant procedure, is, well, do I need to shave my head? And the answer to that question is somewhat nuanced because it really depends on the outcome that the patient wants to achieve, and also what are the sort of immovable issues that the patient may have. So with regards to that, when we talk about should the patient shave the head, the first question is, are you talking about shaving the recipient area or the donor area? Now, the recipient area, for example, is the area in the front if you're going to transplant into here to rebuild a hairline. Now, if you don't have any hair there, then, well, it's a moot point. You don't need to shave that area. But if you do have some hair in that area, you're looking at refining the hairline, adding more density, then the question arises, well, do you need to shave that area in order to get a better outcome? Well, probably if you do shave the area is more exposed. You can see where the gaps are, and then you can add more density specifically and target areas more specifically where you need to. So you're probably going to get a slightly better outcome if you were to shave the area in that scenario. Is it night and day much better than if you don't shave the head? No, it's not. It does slow you down if the hair is long, but probably it's only a small percentage improvement if you do if you don't shave the head. Now, of course, that comes down to the skill set of the person performing the procedure, but generally that holds true. So the question to ask then is, how much of a deal breaker is it for you as the patient who's having the procedure in the short term if you have to shave the area in the recipient zone? So I personally leave the option open to my patients, and we talk about what the outcome will be, what the desired outcome they're aiming for, and how it will look in both the short, medium, and long term. Because if you're refining a hairline or adding density to to the frontal area and lowering the hairline, well, it's going to be obvious anyway. You're going to have tiny little stubble hairs that after a few weeks will, some of them will shed, so it will look a little bit patchy, and you go through that ugly duckling phase. And you can't help that. So sometimes having longer hair there to be able to camouflage that is useful. Some people go, no, that's perfectly fine. I'm happy to shave the head. So that's the recipient area. Then it comes down to the donor area. Now, in large parts, yes, you do have to shave the head to perform FUE surgery, because what we're doing is we're coring out each individual hair follicle. So if you're performing large procedures, then yes, we do get patients to shave certainly the donor area, the area at the back of the head, and we'll shave it down on the day to a 0 so that we can get great access to the hair follicles. That said, there is a newer technique, and we're doing that a lot more frequently nowadays, which is called long hair FUE. And that achieves exactly what it says on the tin. Basically, we're able to perform the FUE procedure, but while still leaving the hair in the donor area long. And there are particular devices that we can do to assist with that, and certainly get a great outcome. The issue is that it is very time consuming. It takes a lot longer to do. And so because of that, we sort of limit the number of grafts that we can do in a particular case with long hair FUE versus shaven FUE. So for example, just to put things into perspective with numbers, if we were doing shaven FUE, we could probably do 3,500 grafts in a single session in one day. But with long hair FUE, that number comes down a little bit to probably somewhere in the ballpark of 1,500 to 2,000 grafts. So it does take a little bit longer. It's a lot more fine. It's a lot more labor intensive. And so probably for most people, and certainly in our clinic as well, it's charged at a higher rate. But for some people, keeping the hair in the donor area long is, like I said before, an absolute deal breaker. There are people who are in the public eye. There are people who have jobs that don't allow for shortened hair. There are people who have long hair and don't want to shave the back of their head. This is a technique that is open to them and that they can avail of. So really, when you're looking at having a hair transplant procedure, have a chat with your doctor about what you want to achieve. And if shaving the head is an issue, have a chat about what can be done if the area needs to be, if the entire scalp needs to be shaved, or could you shave parts of it? Can you trim areas down? Can they perform a long hair FUE in that particular scenario? So there are various different options that you can take, and really have a chat with your doctor and see which one is most appropriate for you. I hope you found that little rundown on FUE techniques useful. Thanks again for watching, and we'll see you on the next episode.